Welcome to Senior Care Today. I'm Shelley Duffy and I'll be your host. Over the next hour, you're going to be hearing from 4 life program providers serving southwestern Pennsylvania. Each program provides coordinated care allowing seniors to remain living in their homes while receiving all of the services they need. These 4 life providers are all part of the national program PACE, operating as the life program in Pennsylvania Community. Community Life will be giving the overview of the life program in this segment, and we're going to start the show by welcoming Richard DiTomaso and Dr. Kalpana Char. Welcome to the show today.
Good morning.
Now, I'm sure the first question that everybody has is, what is the life program? What's it all about?
Well, the life program is for seniors who need long-term care and supports, but it enables them to stay in their homes. The program's been very successful at keeping people out of nursing homes and out of the hospital. This year actually marks the 20th anniversary of the Balanced Budget Act, which made the program a permanent provider under Medicare and Medicaid. Medicare calls it the Program of All-Inclusive Care for the Elderly. In Pennsylvania, all the providers have LIFE in their name, which stands for Living Independence for the Elderly.
Now, what makes someone able to live in their home, but somebody has to definitely go to a nursing home? What is the difference with what you're doing and perhaps when they would absolutely have to go there?
A person living in their home would be able to be left alone for at least a short period of time and not need the continuous presence of another individual for their care.
Where is life available and who offers it? I mean, where can people find out about that?
So the Program of All-Inclusive Care is in 33 states. Pennsylvania is one of the top providers of the program of any state, and it's in 33 counties. In southwestern Pennsylvania, it's in Allegheny, Beaver, Butler, Lawrence, Armstrong, Fayette, Washington, Greene, Indiana, Cambria, Blair, and Somerset. So it's pretty well covered.
How does it work specifically? How does it help people stay well in their homes and be able to do all the things that you were just talking about?
So there are 4 pillars of service that we provide. One of them is that you can come to a health and activities center to see your physician, to have occupational and physical therapy if you need it. There is socially driven activities that are going on at the centers. If you need care in your home to take care of yourself, we have personal care services available, durable medical equipment. We make home modifications for accessibility and for independence. We transport people to and from our centers and to all of their doctor's appointments. And a really important part of the program is that we order and manage all medications out of our health centers, which helps to make sure that people are on the right getting the right medicines and that they're taking them properly.
So what does the doctor do?
So one of the most important parts of senior care is the medical care. And one of the hardest things to do for a frail elderly senior is to navigate the healthcare system. They often have trouble understanding the conversations, making the appointments, getting to appointments, and often get depressed with social isolation and just don't want to go to appointments. So one of the things that the doctor does is to help coordinate and navigate the healthcare system for the elderly. We, with much support staff, are able to make appointments for people. We're able to help them understand, spend more time with them. We have much lower ratios of participants to physicians. So an average physician in a life program may have about 100 to 150 patients as opposed to 1,000 patients or 2,000 patients in your panel. So we really are able to spend the time. We're able to really make sure that our patients have understood and really able to focus on what their goals are.
What are some other challenges that they might face or you might face?
So some of the things that make the life programs unique are that we offer transportation. I think that's a really, really big part of being able to get to doctor's visits, being able to get medication, being able to go to specialty visits. getting the right care at the right time is, I think, one of the advantages of the medical care.
And why is coordinated care so important? What is the key thing that people need to know?
So I think it's often hard to tailor your plan of care to what the patient's goals are. And we spend a lot of time in life programs trying to identify what patients' goals are and trying to tailor our care plans to meet those goals. So going to the hospital all the time as a person starts to age may not be their goals.
All right.
And we try to meet those goals.
If you have chronic illness and disability, you may be getting care from a number of different providers who don't necessarily know what the other provider is prescribing or treating, and sometimes this piles up and can cause complications in elderly folks. So it's really important to have someone who knows you well, who can organize all of that.
Absolutely. Richard and Dr. Char will be back with us later on in the show, so make sure you stay with us. Thank you so much for joining us today. If you'd like to know more about community life, log on to lifeprogramspa.com. And up next, we'll talk to Dr. Brent Nicashire and Dr. Sean Eubank about the medical and medication components of senior life when Senior Care Today continues.